Good afternoon. Thank you, Dr. Khan, for joining us. You're on mute. Sorry, you're on mute.
I said, I'm sorry, I'm at the hospital parking lot on call, but I'll do them from here.
That's dedication. That's dedication right there. We can get started shortly. I do have a couple of members on here. I do have Miss Dika. She is one of the local nutritionists in Snellville. I asked her, and she wanted to kind of, get a familiar idea of how we run the support group. She might be in next month for IBI to kind of collaborate with the practice she has. So I wanted to welcome her, and thanks for joining us.
Thanks for joining.
Thank you so much. I'm so excited to be here.
Oh, you're welcome.
So we are live on all different platforms. And if you want, we can definitely get started shortly.
Sure, definitely. So generally, this is a open forum kind of support group. I'm one of the surgeons at IBI Healthcare. We host this seminar once a month. Basically, it's a support group for patients in different stages of their journey, patients who've had surgery several years ago, patients are just about to have surgery, or patients who just recently gone through surgery, or people even who are not looking into surgery but want to get educated about weight loss and different ways we can help them. So please feel free to ask any questions, surgery, non-surgery, medications, whatever questions come to mind. It's an open forum, and please feel free to ask any of the questions you may have. And do let us know what stage of your weight loss journey you're in, so we can help you get to where you're trying to get to.
Does anyone have any questions they would like to ask Dr. Khan?
It's a very quiet group today. Anyways, I'll start by introducing our practice to Anik. As the questions come, feel free to ask the questions, and I'll be happy to answer them. So just to introduce you to our practice, we're a full-fledged bariatric practice with several doctors and providers in our practice. And we provide a whole gamut of surgical and non-surgical options. So people, even if they've had surgery 20 years ago, say in New York, and they need long-term bariatric care, we provide that to our patients. Patients who are interested in medications, we do have a medicine program that Mr. Anik is the guru of. He runs the medications for most people. As for surgical options, we have all kinds of surgical options. Well, we are one of the few centers in Georgia who offer endoscopic surgery also, which is to some of you maybe a new thing, but we've been doing endoscopic surgery for over 8-10 years. So in patients who have a hostile abdomen or not surgical candidates, the weight loss options such as a gastric balloon, endoscopic sleeve, endoscopic revision of a sleeve, endoscopic revision of a gastric bypass, or if somebody has a gastrogastric fistula leading to weight regain, we offer all of those surgeries. In addition, we have our own surgery center where we do all of our surgeries. 99% of our surgeries are done as an outpatient basis. So majority straightforward gastric sleeves. In low risk patients, we do it in our surgery center. Patients who need revision from a sleeve to a bypass, that also can be done in our surgery center. Generally, we do a pre-op diet for almost everybody to help shrink the liver to make the surgery easier and safer. Typically, most surgeries take about an hour. Gastric bypass take up to an hour and a half too. You generally need a designated driver to the facility and take you home because it's obviously general anesthesia. And we have a track record of over 15 years of performing these surgeries safely. We're a center of excellence. We're qualified a governing body called QuadA, which allows us to do Medicare and Medicaid patients in our facility, which is a huge feather in our cap because use Medicare to let their patients come to your surgery center and have surgery done. So to get that award and get that designation, it requires teamwork. We have amazing team of doctors, amazing team of nurses, support staff, front desk, you name it. We have everything available. We do our billing in-house. We probably the most competitively priced surgery center in the entire state. So having said, if anybody has any questions related to our practice, related to us, or related to any surgery or any weight loss questions you may have, please feel free to ask, and ask the mic to Anik now.
Thank you, Dr. Khan, for that introduction. We do have a question from Facebook. Between GLP-1 medication and weight loss surgery, which is better?
So both work. Both are effective. To be honest, GLP-1 medications has changed the surgical outlook.
Sorry about that. He'll join shortly. I can kind of continue on. So both are effective. It's all about your weight loss goal that you have. Realistically speaking, if you have a long-term goal and you want a more option, weight loss surgery is the way to go. GLP-1 is almost, someone's trying to join, 1 second. So yeah, pretty much weight loss surgery is a more definitive option. With GLP-1 is kind of an adjunct, and it kind of helps with, we're losing weight anywhere from 15 to 25 pounds overall. With surgery, you can lose anywhere from 60 to 90. It's a lot more long-term solution. With that being said, with GLP-1s, you can experience weight regain, and even weight loss surgery can experience weight regain. So it's very important to incorporate healthy lifestyle habits with a proper diet, incorporating exercising, and including water intake. And with Dr. Khan is joining us. I was just filling in with what's for you, Dr. Khan. You're on mute.
That too. Sorry, I lost my connection. So what I was saying is with the GLP-1 medications on the block, definitely it has changed the surgical paradigm. We don't jump to surgery right away. There are certain patients who will benefit from medications and certain patients who won't. So if you're a diabetic, definitely that's the first line of treatment. Surgery is almost always reserved for people who failed medical management, including medication. So we definitely encourage people to try the medications. If it works for them, great. If not, then always surgery is a back. You have to realize that GLP-1 medications, they're a lifelong commitment. When you stop taking the medications, the appetite and the weight can come back with a vengeance. So, and they tend to be quite expensive. So some people, long term, it may not be financially such a great choice. So that also has to be kept in mind. Other than that, it's if somebody wants to try the medications, definitely we're all for it. And if they fail the medication route or have side effects that they can't tolerate, obviously the backup plan of surgery is always there. Any other questions, Anik?
Hey, Pierre, Nick, it looks like you're muted. No one's hearing you.
Sorry about that. Sorry about that. So another question from social media: how long should weight loss actually take place after bariatric surgery?
So that's a very common question. It's actually a very good question. It takes time for you to gain the weight, and exactly the same happens when you lose the weight. You don't want to lose the weight too rapidly because it can lead to other issues also. So say, for example, for the gastric sleeve, I give people a benchmark that you can expect to lose about 50% of your excess weight at 1 year. And that weight loss is about 70% with the gastric bypass. So we usually use benchmarks such as 1 year and 2 years, and then after that, just maintaining it.
Very good question. Very good. One more question from Facebook. Could hormones be affecting my weight? I am experiencing or entering menopause.
Yeah. So hormones do play a major role in weight loss or weight regain or weight gain. Um, uh, for somebody with the PCOS, their hormones are off. Or people with hypothyroidism, their hormones are off. So we almost always check hormones prior to us starting people on medications or offering surgery. So, or insulin, for example, that's a hormone also. That hormone is off. That requires treatment, be it GLP-1 or surgery.
Appreciate that. Thank you for that, Dr. Khan. Yes, Mr. Maxwell.
Yeah, and if I may add, also we do offer hormone therapy treatments at our Loganville facility with Dr. Angelina. So that's always an option to take advantage of.
Yeah, absolutely.
I did put our number in the chat. Once again, feel free to reach out if you are interested in hormone therapy. You can call 678-466-6760, and we'll direct you to the right department if you're interested in hormone therapy. Another question: can I have weight loss surgery if I had a baby a year ago?
Yes, of course you can. So you have to be on birth control for at least 1.5 years, 2 years after the weight loss surgery, because a lot of women, this actually is a treatment for PCOS. So people who couldn't conceive prior, suddenly their hormone levels change and they get really fertile and get pregnant. So you have to use birth control after weight loss surgery, at least for a good 1.5 years, 2, because you don't want to put the baby through the weight loss that you're going through.
From TikTok, what is the risk of death from weight loss surgery?
The risk of dying from a weight loss surgery is 0.01%, so 1 in 1,000. And this is across the board for people, including centers that are not very high volume centers. So you want to go to a center which is a high volume center, which can prevent any complications if do happen. This is not saying that high volume surgeons don't have complications. Surgery is risky, but knowing how to deal with the problem is what differentiates a good practice from an amazing practice.
Well said, Dr. Khan. From YouTube, what causes weight regain after a successful weight loss surgery?
It's generally going back to your old habits. So somebody has high intake of carbohydrates, somebody who stops following up with a bariatric surgeon, somebody who starts drinking their calories in shape of frappuccinos and what have you. So it's basically carbohydrate intake, lack of exercise, and going back to your old eating habits. And there's a high incidence, about 30% of weight regain or weight recidivism in patients who don't follow up with the bariatric surgeon. So we follow our patients lifelong, at least once a year, even after 3, 5, 8, 10 years after the surgery, we follow our patients. So keep an eye on their weight and make sure they're not gaining the weight back, and to stop it if it's still early.
Absolutely. Even after surgery, we follow up with them monthly all the way until a year out. And then like Dr. Khan said, we follow up with them even years out. Okay. Does anyone else have any questions they would like to ask Dr. Khan, or any concerns? There's a question. Someone had a gastric bypass surgery, but I feel like my metabolism hasn't changed. I exercise and eat healthy. What can I do to improve my metabolism?
That's a tricky situation. So the 70% of the way we are is due to genetics. The rest of the factors being socioeconomic, dietary factors, exercise, lack of exercise, eating healthy, not eating healthy, drinking water, not drinking water. These are the small portion of what you can change. Genetics you can change. So generally we recommend restricting yourself to 1200. It's freezing outside, that's why I'm stuttering. 1200 calorie diet, drinking at least 64 ounces of water every day, and at least getting 10,000 steps in every day. So regular exercise, lots of water, low carb, high protein intake, taking your vitamins, and the rest is just genetics. You can't change that.
Thank you for that answer. Does anyone else have any other questions for Dr. Khan, or in general? Miss Jessica, do you want to kind of just give a brief introduction about what your practice has to offer and what services you offer for patients that might be interested, bariatric patients?
Hey, absolutely. I'm so excited to be here. I actually have a client that had a bariatric surgery, and he's doing fantastic, along with the question that they asked on metabolism. From my experience of working with clients, one thing that I've seen that has helped a ton is building muscle mass. So the more muscle that you have in your body, the better it's going to be for your metabolism. So a lot of times we focus on the scale and, trying to be as thin as we can. But if we put that same attention on building muscle, having a high protein diet, you're going to see a fantastic change. But yeah, I help clients with weight loss, and also just changing their body composition. So let's say somebody wants to get stronger, they want to get healthy, I help them through their nutrition. There's a lot of information out there, and sometimes it could get overwhelming, a lot of fad diets. But I always tell my clients the best diet is the best diet that you can keep up for the rest of your life. So I help my clients, create changes in their habits. I work with a lot of people that have, corporate jobs. They sit for hours, and they started off with 2,000 steps. They have a busy life, and today they reached their 10,000 steps. So making changes in their lifestyle has been like one of the most rewarding things that I help my clients with. I don't know if anybody has any questions on what I do, but that's, basically how I help my clients through nutrition, exercise. I also provide a workout routine for each of my clients. I'm a personal trainer, and it's custom. So it's based off of your circumstances. If you only have dumbbells, or you go to the gym, and based off of your goals.
Awesome. Thank you so much for that introduction. I really appreciate it. We look forward to working with you, and, definitely providing our patients the necessary resources to get in touch with you if they have any challenges in regards to nutrition and maintaining a healthy lifestyle. We do have yeah, you're welcome. And then we do have another question. Do you recommend spats or Obera? Which is better? I can answer that. So in reality, both are gastric balloons and they're non-invasive procedures. They're done in our surgery center. The main difference between the spats and the Obera is the duration. For the spats balloon, the duration can be up to 1 year. For
And
Obera,
also an each spats is adjustable.
yeah, exactly. There is adjustable. Yeah. So and Obera is 6 months, and the other main difference is spats can be adjusted. So, for example, if you feel like there's too much restriction or not enough restriction, you can have a procedure to get the balloon size adjusted. The Obera is fixed overall. So that's the main difference. The duration, 12 months to 6 months, and then adjustable. Spats is adjustable. So someone has a personal question for Jessica. How do I know if I'm eating the right portions?
Okay, that's a good question. So it really depends. Like as a coach, when I meet with my clients, I like to see your activity level. I like to see what your current eating habits are like, how much you work out. And based off of that, along with, your height, your current weight, physical activity, what your goal weight is, I can provide custom macros. So that means how many calories I want you to eat, how much protein, how many carbs, how many fats, all of that I would have to, because it's very, very individual. But of course, like if you want to make sure that you're eating enough, it's good for you to be in tune with your hunger hormones, your hunger cues. If you're eating your meals and maybe an hour, 2 hours later, you find that you're snacking, that's a big indication that your portions are not large enough. Like, in America here, we're so used to constantly snacking throughout the day, and we shouldn't have to have the need of snacking if our breakfast, lunch, and dinner is a good portion.
Thank you so much for answering that. Does anyone else have any questions they want to ask? Like I said, we do have our website, which kind of displays all the services we offer. It's ibihealthcare.com. You can always reach us out at email as well if you have any inquiries at patientexperience@ibihealthcare.com. And you can always call us. We're always available if you would like to have a consult or an appointment with one of our surgeons or myself as a mid-level provider. And we can always do that. There's one question that came in. What foods slow down weight loss?
All foods. Ask Mr. Maxwell. He's an office manager and a CEO. He doesn't eat and works out every day. His biceps are bigger than mine.
Go ahead.
Let's let Mr. Maxwell answer that question. Maxwell, what foods are good for building muscle and losing weight?
Hey, Dr. Gunnar, I appreciate that. We can get your muscle just as big as mine too. I believe for the last 2 decades being healthcare, what I find very helpful is high protein diet. So I typically stay on, and I'm sure Ms. Jessica will support this. I typically stay on about 70 to about 80% protein, and then the rest is a mix of carbs and some vegetables, and a lot of hydration, and a lot of rest. And then I keep the sugars down. Obviously, we have to indulge a little bit. I also drink wine a little bit here and there. So I keep those minimal to about 5-10%. And then finally, I do a lot of intermittent fasting. Just like Dr. Khan said, I don't eat. I would typically do about 8 hours a day, fast throughout the day, and have one meal. So typically, example like today, I've not had any my last meal was last night around 7 p.m. and I've had a lot of water to drink. It's roughly about 7 p.m. now. I'm gonna finish up, go home, and then have a well-balanced meal, and that's pretty much it. And then if you incorporate a good regimen of walking, you don't have to go to the gym. Walking does great wonders. Miss Jessica, anything else to add?
Yeah, that's actually fantastic. One thing that I see that slows down the process of losing weight is what Dr. Khan said, drinking your calories. So this is what I see from, typical clients that I've worked with. They go to Starbucks, they have a grande latte with whipped cream and all this stuff. And then they have a croissant because who can really resist the bread, right? It's delicious. But next thing you know, they've had consumed about 600 calories, and that's not even breakfast. They haven't even gotten to lunch yet. Yeah. So I teach my clients to eat, if they're gonna, have a meal, make sure it's balanced. You want to make sure you have your proteins, you want to have carbs. And a rule of thumb that I give all of my clients, I want half of your plate with vegetables. I want greens, I want spinach, whatever vegetable you like, but make it half of your plate, because that increases volume in your meals, and that's going to keep you full for long. What's going to make you slow down that process of losing the weight is definitely high caloric things like drinks, little snacks that you find in the vending machine, walking into Walgreens and mindlessly grabbing a candy bar. Those little things add up because they don't have enough volume. So you're going to be hungry, and next thing you know, you're going to be grabbing for something else.
Thank you for that. There was a question from TikTok. Is there a virtual consult setting available? Absolutely. We definitely offer telehealth appointments in case transportation to one of our facilities is not available. You can always contact that number above, 678-466-6760, and we can gladly do a telehealth consult. Our platform, Athena, allows a video call, as well as we can do it over the telephone as well for your convenience. Sometimes I know everyone has busy schedules, and to make availability for individuals interested in any kind of healthcare related questions and concerns, we can definitely be available over a telehealth consult. And as far as the charges, I'm not really sure. It depends on your insurance, different parameters. But the healthcare team and the care team that does do the scheduling, they could definitely address those as far as charges questions. But we could definitely help you all and accommodate any necessary means of charges if needed. Does anyone else have any questions for us? I know there's some new members in the support group. Does anyone want to, introduce themselves or say what phase of weight loss journey they're in, or feel free, as you feel comfortable. No pressure. Also, anyone on any other platforms, TikTok, Instagram, Facebook, if y'all have any questions, feel free to let us know, and we can definitely address them as well. It's a quiet group tonight. I think everyone's ready for the holidays. Oh, we have a question. Is it normal to lose weight slowly? Absolutely. Like Dr. Khan said, you don't want to lose weight drastically. The goal is you want to lose steadily and over a course of a year, depending on how you're doing it. You don't want to lose too much weight all at once. You want to do it in a healthy fashion. You don't want to starve yourself and have, bad intake overall as far as food and diet. So the goal should be slowly and healthy. You want to do your weight loss over a gradual course, and you should have goals overall. How do I manage extreme cravings? That's a very good question. So it's one of those things. We do offer weight loss medication to kind of help with those cravings. That is an option. Obviously, we can get you in touch with the nutritionist, like Miss Jessica, who can help style your daily habits overall, and kind of provide you guidance overall as far as where you might be snacking unnecessarily or eating or drinking your calories. So we definitely have resources available, and she's a very good resource within our community that can kind of help as far as provide a plan for you to kind of manage your extreme cravings. Miss Jessica, do you have a way as far as how individuals could get in touch with you?
Absolutely. I can go ahead and put my information on the chat.
That's fine.
My website is Lift Healthy by Jess. And there's even a contact page there where you can reach out to me. I also have social media. It's also Lift Healthy by Jess. But yeah, I'll put all of my information right there on the message section.
Absolutely. And do you want to piggyback on anything? Is it normal to lose weight slowly?
Yeah, so that's actually that's what you want. We live in a fast-paced world where we Amazon Prime every single thing, and we think that we deserve to lose the weight immediately. Like, that's what we want. But if we take our time with weight loss, there's a bigger chance to be able to keep those results. Because what I usually see is that people that go into these fad diets, they do extreme things to lose the weight. A lot of times what they're losing is not only some fat, but it's mostly water weight, bone density, and muscle. So we want to preserve muscle because that's part of longevity. You want to be able to live a healthy life. You need your muscle mass for healthy hormones. So I always tell my clients, you can expect anywhere from half a pound max to 2 pounds a week. But even if you're not losing weight every single week, you want to at least, make sure that you're losing anywhere from 2 to 3 pounds a month safely. That's like the minimum. But all the way up to 6 pounds is like, it's good. And then of course, when it comes to the cravings, that goes back to how much are you really eating? So if your diet is usually heavy carb, your insulin is going to spike. You're going to have an insulin spike all the time, and then it crashes, and then you have the cravings because you did not fulfill all your nutritional needs. So that's where having the protein, the carbs, the veggies on your diet is going to be super important. And did I answer that everything?
Yeah, absolutely. There's another question. I think it kind of relates to your field. I'm 60. I feel like I'm losing muscle while gaining weight. I don't move as much as I used to. What I do?
Yeah. So and definitely like one of the key elements that she mentioned was being sedentary. When you sit, it's like when you leave a car parked and you never turn it on, it kind of loses its, ability to function. Well, that's our body. We need to use our body, our bones, our muscle. And especially after 60, there's a huge dip in your metabolism. That's where, as women, we experience a slower metabolism because of our habits. But this is where lifting weights is going to come into play. Like my mom, she's in her 70s, and I currently have her weightlifting because from working at an assisted living for years and seeing patients decline, what I saw that not having enough muscle was causing them to, fall, break their hips. So we want to have strong bones and we want to have strong muscle mass in our body. So definitely the first thing I would recommend is try to get some steps in, right? maybe get one of those watches where you can track your steps, a Fitbit, and let's say your average is 3,000. Well, maybe next week aim for 4,000, and little by little increase your steps. And then think about grabbing some dumbbells too. You can go on YouTube, you know, follow a little workout routine, just get your body used to moving, and you're going to see that not only you're going to feel better, but you're going to see a difference in your body.
Thank you so much. How should one manage a plateau in weight loss? Dr. Khan, are you there? He might be busy. He might be busy.
I can help with that.
Sure.
Yeah, so I see plateaus often with people that go on, you know, extreme diets. And what happens is our metabolism will basically slow down. Our body gets used to the calories that we eat. So let's say the calories to maintain my current body weight is 2,000 calories, right? I go on a diet and I spend about 6 months eating 1,500 calories because I'm trying to lose weight. Eventually, those 1,500 calories is going to become my new maintenance calories. And from there, I have to decrease my calories if I want to see progress. So when it comes to plateaus, you either have to increase your activity output, right? So maybe you were doing 8,000 steps. Let's pick it up a notch and do 10,000 steps. Let's do 12,000 steps. If there's no room to cut calories, because sometimes you're eating like the bare minimum, right? That means that you're going to have to increase your activity level. And then in some cases, what I recommend when I see that the client is not losing weight despite everything that they're doing is a reverse diet. So that's basically giving your body a break from dieting and restoring your metabolism.
Awesome. Thank you so much. Really appreciate you providing us the knowledge, Ms. Jessica. It's been very, very insightful.
Absolutely. So happy to help.
And once again, feel free to put your information in the chat. That way